So good morning, everyone. Turn my sound up a little bit. You all are tuned in for other therapies for healing the pain. And I did this last year, and I just found it really interesting that there's a lot of other options for pain to consider that don't involve medicines. So anyway, I'm Benita Perkins with Durham County Public Health. I do employee wellness for the county. I'm also president of Benny Girl Healthy Lifestyle Branding and Communication. And we've worked with all types of areas of wellness, but especially focused on activity and fitness. But it encompasses all areas of quality of life. And so that's what we're going to discuss today. Anyway, let me share my screen, so to speak. There we go. And hopefully you can see it in presentation mode. Again, Benita Perkins. And let me move this over here. Okay. And I'm going to stop sharing me. All right. So let's get started. Alternative therapies for healing the pain. Pain occurs when something hurts, causing an uncomfortable or unpleasant feeling. The presence of pain often means that something is wrong. Each individual is the best judge of his or her own pain. Usually pain has a purpose. It can alert us that we've sprained an ankle. This pain keeps us from doing further damage. It helps alert people to the fact that something is wrong with their body and needs attention, spurring actions to minimize injury. For example, pain makes you recoil when you touch a burning hot stove, or lets you know you've cut your finger while slicing a tomato, so you'll tend to the wound. In severe cases, extreme pain warns you of life-threatening danger so that you'll seek emergency help, as in the case of the squeezing pain of a heart attack. For many people, pain can linger for weeks or even months, causing needless suffering and interfering with quality of life. So there's acute pain and there's chronic pain. Acute pain usually comes on suddenly and is caused by something specific. It is sharp in quality, and it usually does not last longer than a few weeks. It goes away when there is no longer an underlying cause for the pain. Some causes of acute pain include surgery, broken bones, dental work, burns or cuts, labor and childbirth. Again, after acute pain goes away, a person can go on with life as usual. Chronic pain is ongoing and usually lasts longer than 12 weeks. This is longer than 6 months, but if it's 3 months out and you're still feeling pain, we're going to put that in the chronic category. This type of pain can continue even after the injury or illness that caused it has healed or gone away. Pain signals remain active in the nervous system for weeks, months, or years. Some people suffer chronic pain even when there is no past injury or apparent body damage. Chronic pain is linked to arthritis, cancer, nerve pain, back pain, fibromyalgia, carpal tunnel syndrome, musculoskeletal injuries, irritable bowel syndrome, migraine, or tension headaches. And I should say this, people who have chronic pain can have physical effects that are stressful on the body. These include tense muscles, limited ability to move around, a lack of energy, and appetite changes. The emotional effects of chronic pain include depression, anger, anxiety, and fear of re-injury. His ability to return to their regular work or leisure activities. So let's talk about what people do for pain. An overwhelming number of people use medication to ease chronic pain. And a study of multiple sclerosis patients who experienced chronic pain as a side effect of the disease, 45% used medication to ease pain. However, in the same study, many of the participants were also engaged in non-medication techniques to ease pain. Some of the issues with medication to ease pain, today's focus is on relieving pain, on techniques to relieve long-term pain. While medication is very helpful, in the short term, its extended use can have negative side effects. Opioids are usually prescribed for pain management. Unfortunately, they are associated with elevated risk of overdose, misuse, dependency, or addiction, which can lead to death. Over time, opioids tend to be less effective or require higher doses for dealing with nerve-type pain. Acetaminophen, like Excedrin, have the least amount of extended use issues, but may not be as productive in managing pain as other options. In addition, drinking alcohol while taking acetaminophen can cause liver damage. And I guess we're talking about Tylenol. I said Excedrin, but I mean Tylenol. NSAIDs, which are the regular long-term use of NSAIDs like Aleve or Advil, have been linked to ulcers, stomach bleeding, kidney problems, high blood pressure, and increased risk of heart attack or stroke. NSAIDs should be avoided if you have high blood pressure, heart disease, or kidney problems, or if you're taking blood thinners. And skeletal muscle relaxants are drugs that were approved years ago for short-term treatment of muscle spasms and back pain, and are used today without good evidence to treat chronic pain and other conditions. Recommendations are generally limited to just a few weeks to use these, and they have not been shown to work for muscle spasms beyond 3 weeks. They also have side effects. I think, they can make you drowsy, including falls, fractures, vehicle crashes, abuse, dependency, and overdose. If your pain has overstayed its welcome, you should know that you have more treatment options today than ever before. Here we've listed techniques to control and reduce your pain that don't require taking a pill. Some of these treatments will be familiar and straightforward, and others may be new or eye-opening. So let's go over some. I think we're all familiar with heat and cold. These two tried and true methods are still the cornerstone of relieving pain for certain kinds of injuries. If a homemade hot or cold pack doesn't do the trick, try asking a physical therapist or chiropractor for their version of these treatments, which can penetrate deeper into the muscle and tissue. So yeah, those hot and cold therapy gel packs. And sorry for the quality of this image. I didn't realize it wasn't so cool, but we've probably all tried these. Exercise. Physical activity plays a crucial role in interrupting the vicious cycle of pain and reduced mobility found in some chronic conditions like arthritis and fibromyalgia. Try gentle aerobic activities like walking, swimming, or cycling. Physical and occupational therapy. These two specialties can be among your staunchest allies in the fight against pain. Physical therapists guide you through a series of exercises designed to preserve or improve your strength and mobility. Occupational therapists help you learn to perform a range of daily activities in a way that doesn't aggravate your pain. Being able to do things while, working through your pain. These therapies overlap. A therapist might review your overall medical history and perform various tests and measures to get a sense of any impairments that may be contributing to your pain, including range of motion, posture, strength, balance, and endurance. Chiropractic treatment is the most common non-surgical treatment for back pain. How does it work? Chiropractors perform spinal manipulations or adjustments to manually restore joint mobility and heal injured tissues through controlled force. A chiropractor may also be helpful to treat neuromusculoskeletal complaints like migraine headaches, fibromyalgia, and joint and neck pain. Serious complications. Now, this is rare, but if a chiropractor is not good, they can do things like pinch your nerves, worsen hurt situation worse. But it's very rare. Most chiropractors are going to make your life better. So now we get to some more maybe not as well-known options for pain therapy. These are mind-body treatments. And they help restore a sense of control over the body and turn down the fight or flight response, which can worsen chronic muscle tension and pain. So we're going to go over cognitive behavioral therapy, mind-body, well, we're talking about it here, guided imagery, biofeedback, and hypnotherapy. So cognitive behavior therapy is a form of talk therapy that helps people identify skills to manage negative thoughts and behaviors around their pain. For pain management, CBT, and I'm going to use the term CBT from here on, helps patients change their awareness of pain and develop better coping skills, even if their pain doesn't change. Currently, CBT is the prevailing psychological treatment for individuals with chronic conditions like low back pain, headaches, arthritis, face pain, and fibromyalgia. CBT has also been applied to pain associated with cancer and its treatment, as well as anxiety and insomnia. How does it work? CBT focuses on the relationship between thoughts, behaviors, and emotions. Negative beliefs about pain can lead to bad coping, exacerbation of the pain, and greater disability. CBT teaches patients effective coping strategies and helps replace those negative thoughts patterns with less harmful thoughts, helping patients increase adaptive behaviors, identify and correct bad thoughts and beliefs, and increase their ability to manage pain. I have not been in that position where I've had pain that was not controlled. And so I find this a really interesting way to approach it. And, you know, I just think it's, you know, something really to consider. Numerous meta-analysis and large randomized controlled studies support CBT for chronic pain. A review of 22 studies found that CBT has positive effects on pain intensity, pain-related interference, health-related quality of life, and depression. One study, a large study, looked at the short and long-term effects of CBT for a face disorder called temporomandibular disorder, a condition that causes severe pain and discomfort in the face, jaw, and shoulders. At a 12-month follow-up study, patients were 3 times more likely to report no pain interference and twice as likely to report clinically meaningful improvement compared to a control group. Okay, that's what I just said. So just take a minute to reflect that. That's what I just talked about. But the studies and the fact that those in the studies were more likely to not have a pain interference than those who did not participate in CBT. The next one, we're going to look at guided imagery. It goes one step further with mindfulness to manage pain using relaxation techniques and visualization of calming mental images to manage acute and chronic pain. When you're under stress, your body's fight or flight mechanism kicks in. Cortisol and other stress hormones can ratchet up inflammation levels in your body. The mind-body practices like guided imagery calm the nervous sympathetic system. When in a state of deep relaxation, you visualize your body as you wish it would be. The process erases stress, lowers cortisol levels, and brings a decrease in pain perception and the anxiety with it. Now, closing your eyes and imagining your pain away, is that really effective? It just seems like it's too good to be true. It may sound like an ineffective method of pain management, but another study found evidence that this relaxation and visualization technique can be effective for the management of cancer-related pain, anxiety, nausea, and depression. In a review of several studies, guided imagery brought statistically significant improvements to 287 individuals suffering from arthritis and other rheumatic diseases. Biofeedback. This can help you gain more control over normally involuntary nerve pain signals. It's used to help prevent or treat conditions like migraine headaches, chronic pain, incontinence, and high blood pressure. This technique also involves learning relaxation and breathing exercises with the help of a biofeedback machine. This machine turns data on your physiological functions like your heart rate and blood pressure into visual cues like a graph or a blinking light or even an animation. Watching and modifying the visualizations gives you a degree of control over your body's responses to pain. During a biofeedback session, electrodes, as in this case, are attached to your skin. Finger sensors can also be used. These sensors send signals to a monitor, which displays a sound, flash of light, or image that represents your heart, your breathing rate, blood pressure, skin temperature, sweating, or muscle activity. The idea behind biofeedback that by harnessing the power of your mind and becoming aware of what's going on inside your body, you can gain more control over your health. When you're under stress, your heart speeds up, your muscles tighten, your blood pressure rises, you start to sweat, and your breathing quickens. You see these stress responses as they happen on the monitor and then get immediate feedback as you try to stop them. Biofeedback sessions are typically done in a therapist's office, but they're a computer program, the biofeedback sensor to your own computer. Hypnotherapy. This is an alternative practice where a licensed hypnotherapist guides you through a highly focused mental state. Hypnosis is used for the treatment of chronic pain and typically involves putting you in a hypnotic induction, followed by suggestions for comfort and relaxation. Patients are often taught a cue that they can use on their own to enter a state of comfort. How effective is hypnotherapy? A review of 13 studies revealed that hypnosis is significantly effective for chronic pain conditions, including low back pain, arthritis, cancer, and disability-related pain. In some cases, hypnotherapy reduced chronic pain for up to 3 months. In one controlled study, fibromyalgia patients who received hypnotherapy showed significant improvements in pain reduction, as well as fatigue and sleep patterns. And now let's go to some physical things. Yoga, Tai Chi, and Pilates. Yay, Pilates. These exercises practice breath control, meditation, and gentle movements to stretch and strengthen muscles. Many studies have shown that they can help people manage pain caused by a host of conditions, from headaches to arthritis to lingering injuries. And I can speak from my own experience in my Pilates classes. I've had a lot of students tell me, who had back pain coming into the class, had issues primarily dealing with back pain, and felt that Pilates really helped them to improve their pain and even have it go away. And sometimes Pilates gets to the cause of the back pain, and that might be the reason. But these are something to consider when you're in a situation where you really need to get relief. And therapeutic massages, yay! Not just an indulgence. A massage can ease pain by working tension out of muscles and joints, relieving stress and anxiety, and possibly helping to distract you from pain by introducing a competing sensation that overrides pain signals. A massage aims to reduce pain by increasing healing and disturbing the pain signals sent to the brain. During a massage, the skin and fingers create friction. The friction encourages flow to increase. Oxygen and nutrients are carried within the blood, and these are essential for the repair of damaged muscle fibers, and increasing the blood flow, therefore, increases the rate of healing to help reduce pain. So it's really providing oxygen and nutrients that are essential for repairing damaged muscles. The friction created between the skin and fingers also creates a new sensation. The new sensation is picked up by the receptors within the skin, disturbing the signal sent to the brain, which means fewer messages are sent to the nerve to create a feeling of pain. A new message encouraging relaxation and decreased pain is sent to the original message to the brain. So I think we all know massages. Most of us do it for relaxation, but it really is an interesting concept that it can help with pain by increasing the flow of blood and by providing a competing sensation to overcome the sensation of pain. Therapeutic touch and Reiki healing. Reiki is a Japanese technique for stress reduction and relaxation that also promotes healing. It is administered by laying hands, and I say that in parentheses, and is based on the idea that an unseen life force or energy flows through us and is what causes us to be alive. The Chinese would call that our qi. If one's life force energy is low, then we are more likely to get sick or feel stress. And if it is high, we are more capable of being happy and healthy. Therapeutic touch and Reiki healing are thought to help activate the self-healing processes of an individual and therefore reduce pain. These so-called energy-based techniques do not require actual physical contact, but they involve close proximity between practitioner and patient. In the past few years, several reviews have evaluated the efficacy of these healing approaches to ease pain and anxiety. Although a few small studies show these techniques are beneficial and have no significant side effects, the studies, they've been limited, and there has not been any definitive conclusion as to this technique reducing pain. Further studies are needed before evidence-based recommendations are made. But, if they're helpful and a lot of people use this technique for pain reduction, then it's worthwhile to try. Acupuncture. The World Health Organization currently recognizes more than 30 diseases or conditions that can be helped by acupuncture treatment. One of the main uses of acupuncture is for pain relief. In 16th century Chinese doctors believed that illness was due to an imbalance of energy in the body, and acupuncture or disposable stainless steel needles are used to stimulate the body's 14 major meridians or energy carrying channels to resist or overcome illnesses and conditions by correcting these imbalances. Acupuncture is thought to decrease pain by increasing the release of chemicals that block pain called endorphins. Many acupoints are near nerves, and when stimulated, these nerves cause a dull ache or feeling of fullness in the muscle. The stimulated muscle sends a message to the central nervous system, causing the release of the endorphins, and endorphins, along with other transmitters, block the message of pain from being delivered to the brain. Acupuncture may be useful as an accompanying treatment for many pain-related conditions, including headache, low back pain, menstrual cramps, carpal tunnel syndrome, and a lot of others, arthritis as well. Plant-based herbs and spices. Many herbs and spices treat inflammation and other related conditions. Here we have willow bark, which people have been using for years. People have been using willow bark to ease inflammation, the cause of most aches and pains, for centuries. The bark of the white willow contains the chemical salicin, which is similar to the main ingredient in aspirin. Originally, people chewed the bark to relieve pain and fevers. Now, willow bark is sold as a drink that you can brew like a tea. It also comes as a liquid supplement or in a capsule form. Willow bark is used to help relieve discomfort from headaches, low back pain, osteoarthritis, and other conditions. Now, willow bark does have its own side effects. It can cause stomach upset, may slow down your kidneys, and can prolong bleeding time like aspirin. It should only be used by adults. Similar to how aspirin taken in large quantities can be harmful to children, willow bark can be poisonous. If you're sensitive to aspirin, or if you're taking any over-the-counter anti-inflammatory drugs like aspirin, ibuprofen, or inaxaprine, you should avoid willow bark. And let's go to turmeric. Turmeric is the spice that gives curry its yellow color and unique flavor. It contains the compound curcumin, an antioxidant that helps protect the body from free radical molecules that can damage cells and tissues. Some people with arthritis turn to turmeric as a natural pain reliever because it relieves inflammation. And I was having some knee issues personally, and I was advised to take turmeric. And I'm going to give you testimony. My knees have felt better. And that's been in the past month or so that I've done this. So that's my own testimony to turmeric. Cloves. Whole cloves are often used for cooking. As medicine, cloves can be found in capsules or powder form. You can use cloves for a wide range of conditions to ease nausea and treat colds. They're also used for arthritic inflammation, pain, and toothaches. It can also be part of a topical pain relief. So you can take it internally or mix it with oils to put on your skin. Clove oil can increase the risk of abdominal bleeding. So people with bleeding disorders or who are taking blood thinners, again, should be careful when consuming clove products. Aromatherapy. The U.S. Food and Drug does not regulate essential oils. This means that essential oil products can vary in purity, strength, and quality across manufacturers. So be sure to purchase essential oils from reputable brands. Essential oils can be applied or inhaled or applied topically with the oil. And do not swallow essential oils. For most people, the idea of smelling something to make you feel better may sound silly, but aromatherapy has been used for pain management since the time of the ancient Egyptians. Peppermint oil, lavender oil, chamomile oil, and African miracle oil have been used for pain management. How does aromatherapy work? It positively stimulates the limbic system of the brain to ease chronic pain and anxiety. How effective is aromatherapy? Dr. Oz, yes, this is a little dated, studied aromatherapy to expedite recovery time and reduce anxiety in his heart patients. He found it effective because it works directly on the brain's emotional center. He recommends lavender, chamomile, or eucalyptus oil, or even the scent of green apples to reduce migraines and joint pain. According to the University of Maryland Medical Center, Aromatherapy has been shown to be effective to relieve anxiety, stress, depression, and in severe clinical trials, it has been used for women laboring, who are in labor, to reduce their need for medication during labor. And just some ones to consider, other oils to consider. I'll just put this up quickly: lavender, rose oil, bergamot, and we discussed chamomile, eucalyptus oil. So just it's something to research, but there is some evidence that inhaling or aromatherapy or applying some of these essential oils with a carrier like a coconut oil or some type of lotion can be helpful on, for pain. Dietary approaches. Some people believe that changing dietary fat intake or consuming plant foods that contain anti-inflammatory agents can help ease pain by limiting inflammation. While medication and other treatments are important, many experts say an anti-inflammatory diet may help with conditions like arthritis. And changing what's on your plate it won't be a magic cure, but an anti-inflammatory diet might lessen the number of flare-ups you have, or it might take your pain down a few notches. And anyway, an anti-inflammatory diet is widely regarded as a healthy diet. Even if it doesn't help with your conditions, it can help lower your chances of having other problems. Anti-inflammatory diets consist of fruits and vegetables, the usual suspects: whole grains, beans, nuts, fish. What's considered a healthy diet is what's going to help you, with inflammation, which is a major cause of pain. And just real quick on nutritional supplements, glucosamine sulfate and chondroitin sulfate, they're not as well talked, they're not talked about as much now as they used to be, but it used to be a big deal that if you had knee pain or something, you take one of these over-the-counter supplements. But the studies have shown they really don't have benefits. But that's what the studies show. If you think they're helpful, and take them. There's no side effects and they're well tolerated. And let's talk about the last one, medical marijuana. It's controversial, it's a controversial non-opioid alternative for pain. Spurred on by the recommendations from the World Health Organization, the United Nations voted to recognize the medical value of cannabis. More and more states are passing laws allowing medical marijuana to be used for conditions. Hell, they're passing laws, just not even medical. You can just use marijuana, even for leisure. But initially allowing medical marijuana to be used for conditions like pain, headaches, nausea, seizures, and Crohn's disease. How does medical marijuana work? It contains hundreds of chemical compounds, but THC is the cannabinoid in marijuana that has been most widely researched. THC binds to receptors in the brain to produce effects like reducing pain or anxiety. The sensation of being high is what makes this treatment so controversial. How effective is medical marijuana? 7 double-blind studies associated cannabis use with lowered chronic pain and neuropathic pain. And according to reports by U.S. Health News, medical marijuana appears to be mostly a safe treatment for chronic pain without an increase of side effects. It has a better profile compared with opioids for long-term chronic pain. And of course, now there's gummies, there's other ways to ingest, either smoke or ingest marijuana, but the studies are saying that it is helpful for pain. So it's definitely something to consider when you're at a place where you're looking for alternatives. In conclusion, alternative treatments can be used with traditional medicine or as an alternative to it. However, as with any type of treatments, complementary and alternative medicines don't work for everyone the same way. If you're considering one of these alternative options, have a conversation with your doctor first. Remember, you may have to try several pain treatments, alternative methods, or perhaps a blend of these treatments to figure out which ones will work best to alleviate your pain or other symptoms. And with that, let me go. This is my information if you have any questions or comments. And I'm going to stop sharing my screen. And that's that. Are there any questions, any comments, anybody who's used some of these treatments and has testimony? You can come off your mic if you'd like. Yes, no?
Hey.
Oh, wait, I see cats too. Go ahead, yeah.
Oh, I would just be concerned about the THC treatment. Now, is this a doctor prescribed thing now in North Carolina?
Medical marijuana, no. But I know in New Jersey it was, now it's legal in New Jersey, but New Jersey, California, there were a lot of states where you got a prescription and then you could go to a dispensary and purchase marijuana based on your prescription.
Okay, do you know, and you might have said it, but I'll ask again, what the stats is on that? Like, is it a proven treatment? I guess I'm asking.
Well, that's what this is. They've done many, many studies. What I am going to say is the World Health Organization asked the United Nations, which then did it, voted to recognize the medicinal value of cannabis. So this is not just us, this is world organizations recognizing the value of cannabis for medical use. So I would say that's an endorsement that it has been helpful for people.
Okay, thank you.
Okay, and let me look at the chats. Good morning. I can see. Is it true that most chronic pain is caused by? That's my understanding, LaTanya, is that inflammation is one of the biggest causes of chronic pain, and that's why things like, aspirin and the things that tend to minimize inflammation tend to help with pain. And so, like some of the things we've talked about with the what are they? I want to say that. Let me go back to it. The plants, herbs, and spices. Okay, they have been like turmeric, have been related to reducing inflammation. So they do have those properties, and so that is for sure a sign of. But I would think yes, a lot of pain or most pain is related to inflammation. I am not a doctor, but based on what I've been studying and understanding, that is the case. Most of the time, it depends on the therapist to choose with their clients. This is true, Olivia. And I will, I can share the slides, Nancy, if you'd like. All right. Any testimonials out there? I find the cognitive behavior therapy and those mind-body things very interesting. And I'd be really interested to hear someone's personal experience with these types of pain management techniques that deal with mind-body. Because that's amazing to me that we can provide that kind of, our minds can have that level of strength that we're not even aware of to be able to manage some of those issues. There's a ginger and turmeric tea out there that's not too bad tasting and has been helpful. Okay. Like I said, I've got my own testimony for turmeric. So it has been helpful.
I got a little testimony. I was in a car accident about 3 weeks ago, and I was hurting so bad. And every day, like for the first week, I would say, God, Palestine, you feel so bad. Take your medicine and lay back down. Take your medicine and lay back down. I literally did this like for the first week. Go to therapy, take my medicine, go to the doctor, go to therapy. And I was telling my sister one day, I said, you know, Latanya, I said, I feel so bad. I said, I don't even feel like I got energy anymore. And she said, stop telling yourself that. She said, if you wake up in the morning and you don't feel so good, you know, give yourself a little
Pep talk.
meditation, a pickup, a confident, positive word, you know. And I was like, Lord, I'm gonna have to go back to working because this is like my second week back to work. I said, Lord, I'm gonna have to go back to work in a little bit, and I just don't know how I'm gonna do it. And this or that and the third. But after talking to her, I was looking online for some meditation. And so I get up in the morning and I have this little meditation session, and I tell myself, you're going to be productive today. You are going to get through today, you know. And so that's not CBT per se, but the mind and body and the meditation and the connection that it makes. Now I am again, like I used to, 5 o'clock in the morning. I'm up. I'm not always running like I used to, but I do get up at 5. I'm out of my house a little bit after 6. I'm to work at 7 o'clock because the first week I was kind of sluggish with that. But I'm back to work now. 7:15. I'm walking through that door. I'm making my shake. I'm having my coffee.
That's
You know,
testimony.
and I'm only on partial hours. But I have cut back on the pain medication because you know they was giving me first they started off with an opiate, and of course I know I work for the county, I know this epidemic, and I went back and I said no, I'm not taking this. So then they downgraded me to some tramadol,
And
and
that worked.
now I take a half of one in the afternoon because by the time I get finished with my workday, I'm a little bit, you know, there as far as the pain is concerned. But I take a half of one when I get ready to go home, which helps me to relax. And sometime at night, I wake up and have to take like a Tylenol PM, only one, or something like that to help me get to sleep if my back is hurting real bad. But that thing about the mind and the body, I just want to say there is something to that, and how we speak to ourselves and how we think of ourselves. And if we think we can't, we can't, you know. And pain is real. I'm not, you know,
Pain
not
is
saying that
real,
it's not.
but our minds are strong.
Yes. Yeah.
Pain is
That part.
real and our minds are strong. So that's testimony. Well, folks, if there's, let me see, is there anything? No, nothing else in the chat. If there's no other comments, I hope this was helpful. Thank you, Nancy. I hope this was helpful, and that the next time you are in a situation, you think of an alternative to, and this is really, I think, more for chronic situations where you really are looking at the opioids and that, you know, really pain that is just unbearable. This is where, you know, we really looked at some options. But anyway, thank you so much. And I will see everybody next month. Bye-bye.